God bless you. I'm Father Mike. Let's talk about the where. Let's talk about the places where we go to anoint these COVID patients. When we started this initiative, we thought that we would exclusively go to hospitals, but it hasn't always been like that. And when we think about hospitals, we frequently visit the ICU, the intensive care unit. It's also called an intensive treatment unit, ITU, or CCU, the critical care unit. And these are special departments in the hospital. There's also a PACU, the post-anesthesia care unit, an important part of the hospital where patients wake up. And hospice care is also another type of place where we have gone. They can be in hospitals, they might be outside of hospitals. And as many of you know, hospice is medical care to help someone with a terminal illness live and prepare to go to God. It is an interdisciplinary team of professionals who address physical, psychological, and spiritual distress. And they focus on both the dying person and the family members. Within hospitals, outside of these care units that I've already discussed, sometimes we will just go to a regular room on a floor. It might be a dedicated floor or a section that's dedicated to just patients with COVID-19. And there are many times extra precautions. And I've already mentioned some of those in the past, like the plastic partitions with the zipper entrances. And another facility where we anoint COVID patients is nursing homes. So at nursing homes, there are some that are more or less like hospitals, and there are different levels of care at these nursing home facilities. Another place would be private residences, and these can be homes, apartments, and you can understand the special challenge for us priests to go into these places, because certainly they would not be like hospitals, and these homes would not have their own personal protective equipment, so it's important for us priests to bring that equipment. It would also be more difficult to social distance ourselves inside the house, so we'd have to call ahead to see where's the room where the patient is, who are the other family members in the house, and if it's possible for me to not have that contact within 6 feet with these other family members. So these are special concerns that we have when we would go to private residence. Our particular where, so the where we are, which I've mentioned to you, is that we're in a rectory. Some of these rectories where these different teams of priests are in the Archdiocese, I believe there's 7 of these teams. Some of them are vacant rectories, or they're quarantine ready rectories where we can be able to live, and it's a pretty easy transition for us. And other facilities where these priests are living are college dorms. The school's closed right now. The priests are able to live in dorms. But overall, I just wanted to say that with all these different situations and where we're going to see patients and where we're coming from to see these patients, Christ is in charge from wherever we are to wherever we go to see these patients. It's all part of what Christ is doing to help us. And that it's just a real amazing story of God's providential care, his love for us, even though it's a really uncertain time. Please pray for me, and I'll pray for you. God bless.